But what happens with ayahuasca is it goes in and it resets the dopamine receptors and the serotonin receptors so that you don't have that neurochemical imbalance that causes depression, if that was the reason. And then if it's behavioral or habit or lifestyle, you have a dissociative experience that's healthy where you can see all the things that are holding you back.
Hey guys, I'm Ashley Dawn Rivard, and you are now Into the Dawn, a provocative podcast that looks at all things taboo, such as suicide, grief, sex, addictions, and more. Each week, I talk with experts who successfully investigate their areas of interest. And if you like what you hear, please remember to subscribe. Dr. Jeff McNairy has been working in the healthcare field for 25 years. He is the former director of Passages Malibu and now both Chief Operations Officer and Chief Medical Director of Rythmia Life Advancement Center. Rythmia is one of the few places that serves the ancient medicine ayahuasca under medical supervision. Through Dr. McNairy's intense experience with the most desperate patient populations, addiction, acute mental health, and trauma, he has seen that the only real healing can come from within. Coming from the Western world, just kind of touch on how did you get involved in ayahuasca?
Yeah, it's a crazy story. I've always been a healthcare professional who second guessed the system I was in. I studied medical anthropology as an undergrad. I got a master's in public health from UCLA. I got into medical school. I decided not to go because I didn't like the way that the Western model was. I was managing OBGYN clinics at UCLA during that whole time of taking the MCAT and all the pre-meds after I had my master's, and I was just disillusioned with it all. And I decided to work for the Department of Health in Hawaii for a couple of years, did some Native Hawaiian sort of healing techniques that was really cool. Wanted to get a doctorate in psychology, moved back to Los Angeles where I'm from, got my doctorate, and started managing a rehab that was not a 12-step drug and alcohol rehab. And at the time, it was very controversial because most recovery stuff is 12-step based. And so we were sort of the first place that was sort of mainstream to do other things, like look at spiritual counseling and body work and Chinese medicine and sort of underlying causes for addiction and looking at trauma. And all that stuff was what I believed in. And that was called Passages. That was the name of the place. And so I became the administrative director of that facility while I was in grad school, get my doctorate. And that's where I met Jerry. And I left Passages eventually after 8 years. And I worked with Jerry for about 5 years, who was the CEO of Rythmia, but was the guy who came in as a drug addict to Passages he was from Pennsylvania. And I worked with this guy for about 5 years, and I just couldn't break through to him. And he was struggling with all kinds of craziness. And on a whim, he found some plant medicine and decided to try it because he was becoming suicidal. He's been suicidal before. And it changed his life, and it completely turned him around. And I was very skeptical and hesitant. I'd never seen or heard anything like this. I knew about plant medicine. I didn't know much about it because we're not trained about it in the West. Like all my 18 years of grad school, they never once talked about ayahuasca or iboga or psilocybin or anything. And so you're kind of like on your own to figure it out. So I didn't know much. I just said, go do it. And it changed him. He became a different guy, and then I did it. And that's where we decided that we wanted to have a place that was honoring the plant medicine traditions of ancient, indigenous peoples of Latin America, but also bring it to the Western world, whereas a lot of people need it. And we sort of lost our connection to nature. I grew up in LA. I mean, my connection to nature is minimal, except I went surfing a lot, and that was cool. But it's like we've lost that bridge, right? So what Rythmia is trying to do, what I'm trying to do, is bring that indigenous ancient wisdom that's so amazing and healing, and bring it to an environment where people could actually access it, and have a place where they could be safe and do it. So that's kind of like how that all happened. In a nutshell.
Yeah. So for those who don't know, what is ayahuasca?
Ayahuasca is a blend of two plants, and it's from the Amazon basin of South America predominantly. And one of the plants is a vine, and the vine is what they call a monoamine oxidase inhibitor. So it's an MAOI. And there's a lot of pharmaceuticals that are MAOIs. And what MAOIs do is they turn off the stomach enzymes so that the other plant that has the dimethyltryptamine in it, which is the active ingredient in ayahuasca, can actively be absorbed into the body and start to do its process of healing. So the combination of those two plants is what we call ayahuasca. So we have a vine and a high content DMT regional plant based on where these shamans live in the world. And they mix them together and you drink it. And that's what ayahuasca basically is at its core.
How does that affect the brain?
Well, what happens is when we have trauma or we go through really serious parts or events in our life, we have a part of the brain called the amygdala. And what happens is that amygdala is very important. It stores our subconscious memories and emotions. Now, if I'm in a traumatic moment, my emotions will get in the way of my survival. Because if I'm feeling terrified and I just freeze, I'm not going to be very safe. So I need to be on my toes and I need to fight or flight, that kind of response. And my emotions get shoved over into the amygdala. So my fear, my anger, my resentment, my confusion, all those emotions that might have been present during trauma get pushed into the amygdala. And then they stay there. And then other traumatic things happen in life. And we push them there, we push them. And eventually they start to sort of creep out subconsciously. And we're not aware that they're creeping out. And so I don't trust people. I'm hesitant to get into relationships. I have self-loathing behavior. I might have a drug or alcohol issue to sort of buffer those emotions I don't understand. So what happens is when I drink ayahuasca, it goes into the brain and it opens up the amygdala and connects it to our prefrontal cortex. And our prefrontal cortex is our sort of conscious, rational self. It's where our thinking process is and our sort of awareness. And then what happens is those two parts of the brain link up. And then I'm aware, wow, yeah, I had trauma when I was 5. That makes sense that I don't trust men or I don't trust women or whatever. And I can see that that's holding me back. And I can feel these emotions of fear surfacing and I can feel them and just let them go. And then in the morning I will wake up and I feel like $1,000,000. I'm tired. I feel a little beaten down, but I feel clear and I feel resolved. And so the ayahuasca does neurochemical rebalancing of dopamine, serotonin. It looks at all kinds of neurochemicals and gets all that sorted out. It's like a reset button. So it's working on our subconscious, our conscious, and our neurochemical balances.
If you're depressed or anxiety, you're taking those medications, it suppresses it, right? But with ayahuasca, you're going to feel that.
Yeah.
You're right. Like you kind of go through hell.
Well, for example, with depression, there's 2 reasons that depression exists. Some people have one of the 2 reasons and some people have both reasons. One reason is that their dopamine is low. So people are just born with low dopamine, or they're living a lifestyle that lowers dopamine, like drug and alcohol abuse can lower dopamine. It surges it, but then it has a rebound effect. And so there's all kinds of imbalances. So that causes depression. If I have low dopamine, I'm depressed. Another thing that causes it is just my way of life. And I'm thinking inappropriately, or I'm making poor decisions, or I'm living in a situation that's abusive. So there's all these behavioral sides that can also make me feel depressed. And so I might have both of those things or one or whatever. But what happens with ayahuasca is it goes in and it resets the dopamine receptors and the serotonin receptors so that you don't have that neurochemical imbalance that causes depression, if that was the reason. And then if it's behavioral or habit or lifestyle, you have a dissociative experience that's healthy where you can see all the things that are holding you back and why you've chosen these decisions and why you're picking these types of people for relationships and all that. And then you can get clarity on it and sort of like almost be your own therapist in a sense, right? And so then you have you move forward and you can have some new awareness. You can make better decisions. You can say, I need to leave that relationship now, or I need to stop doing that dumb thing I do all the time that I wasn't aware, or whatever. And so that's how ayahuasca is very different than SSRIs, right? So SSRIs are the meds that usually given for depression, and those just block symptoms, right? They just treat symptoms. They don't resolve anything. And they buffer it, and it ends up not working eventually, right? So
what then is the biggest myth or stigma around ayahuasca, or all the misunderstandings people have?
people think it's just for hippies and for weirdos, and that it's demonic, and that it's nothing good can come from some guy living up the Amazon basin, right? The shamans are quacks, that kind of thing. That's pretty much what people will say.
But why? Why do people think that? If you hear, or if people are doing mushrooms, I know ayahuasca is different than mushrooms. But yeah, when people are, I did mushrooms this weekend, and these people kind of have a similar vibe, right? Where you could consider them hippie. So are people doing ayahuasca to get high and just trip out?
Sure. I'm sure that some people are, but not most, because I wouldn't call it it's not pleasant. It's not, the results are amazing. It's definitely worth it, but I wouldn't call it fun. I've never had a fun ayahuasca experience. It's been work. This is what it is. It's work, right? So the government has tried really hard for decades to make psychedelics and any sort of mind expanding substance or process, for that matter, something that is illegal or bad or crazy, and they've demonized it. And the reason is because if I have self-confidence, and if I have a lot of self-awareness, and if I feel empowered as an individual, and I can think for myself, and I know what I want, and I know what's important in life, I don't need government to tell me what to do. And so I basically am not a supporter of these structures all around me, whether it's a pharmaceutical industry or a government that's oppressive or whatever, any sort of social system that wants to manipulate and control me and get me to consume and spend and da-da-da. All those things that allow me to be free are frowned upon and demonized. So a lot of that is just residual sort of brainwashing that society's gone through over the years. We're just barely breaking out right now that cannabis is okay now, in most part, not most yet, but it's starting to break through as a viable remedy for all kinds of things. And it was an absolute crime that was demonized back when it was in the 50s and 60s. It was absurd how they did that. And so it's similar with plant medicine and psychedelics and certain things. Now, anybody can abuse something at any time, obviously. But I have an addiction background working with rehabs and stuff. So I've seen everything happen with any substance or behavior, right? But if you're doing it with intention, it's a whole nother ballgame, right? So that's a big part of why people look at it weird. The other part is that we've been told in the West that experts know better than we do what we need. So psychologists and psychiatrists and medical people. Now, obviously those people, I'm a psychologist, those people are all very well trained and have a lot of good insights on things and can help point people in the right direction. But I remember when I had my patients in LA ask me, like, what should I do? I'd be like, I have no idea, dude. Like, I'm not you, but let's talk about some options. Let's maybe brainstorm. Let's see what you think. And then I'll support you in your decision, right? So we're always told the opposite, like these people know better than we do what's up. So a shaman can't know. I mean, what the heck is this guy? He looks like a weirdo in the jungle. So they don't have a lot of confidence in people that aren't, doctors or psychologists, medical people. So that's another sort of barrier, with a stigma to plant medicine.
Now, is ayahuasca addictive?
Well, the way I look at it is any substance that's addictive has two characteristics to it. Number one, you build tolerance over time. So you need more and more and more of the substance to get the same effect. The other thing is that if they stop cold turkey, then they go into withdrawal. So if you have those two things occurring, then you're addicted to something, a substance, a behavior, whatever. Ayahuasca is the exact opposite of that. Over time, you need less ayahuasca. The shamans barely even take any. They're just around this stuff and they start to feel the effects. So over time, you need less ayahuasca to get the same effects because you're more clear, you're more connected, you don't need as much. And number two, if you did a bunch of ceremonies in a row and then stopped, you would not go into withdrawal. You'd be tired. You'd be tired, but you wouldn't be going through withdrawal. Yeah. So it's not addictive in that sense. Now, behavioral addictions, not substance addictions, but behavioral addictions are very common in society. Sexual addiction, eating addiction, over exercise addiction. There's all these behaviors, spending, overspending, shopping addictions, all these behavioral things, because behavioral addictions help us avoid life, just like substances do. So can I get addicted to the process of ayahuasca, like going to a session, sitting down, drinking it, the whole thing, waking up in the morning and then having clarity? And then can I get addicted to that? Sure. I mean, you could behaviorally, but it's very rare. It's the same as saying, like, I get addicted to making breakfast, in the morning. It's like, I don't, like, I just do it, but that's about it.
Why do some people drink repeatedly then? You do one session and they have this wake up call, right? And awakening. And then 3 months later, they're going back to do another ceremony.
Yeah. So there's a couple reasons why people do it more than just like the initial sort of experience, right? There could be a couple, let's say people get 3 or 4 in a week as their initial thing. And then some people come back, like you said, 6 months later, do it again, or a year. Some people want to go deeper. They like the knowledge they receive. They like to go deeper. Some people like the community of people that they're hanging out with and meeting, and it's really supportive. Their network expands, like with people that think the same. They like that. Some people didn't handle everything that they needed to handle the first time. Maybe they fought the medicine a bit. They were resistant. Maybe they had a lot of trauma and they kind of just touched on it the first time, and they got to come back and do it again to kind of break free. And there's other cases, which are the ones that I don't like as much, which is they're trying to get an answer that the medicine's not giving them, and they're stubborn, and they just keep trying to get the same thing that they really are looking for. They're not listening to the process. They're not listening to themselves, and they're stubborn, and they're kind of trying to force the medicine in a way. So that's kind of the minority, but that happens too sometimes, but it's more about going deeper and doing more work, really, is what it's about.
Are there any negative side effects?
If somebody is bipolar 1, which means that they're often in a manic phase, and then occasionally they'll drop down into a depressive state for a short while and then jump back up to manic phase. Those people, if they do ayahuasca, some of them, which we haven't been able to collect exact data on, but we're noticing some of them can spin out into a psychotic manic phase, which keeps them in a sort of high level serotonin state until that just naturally subsides over a couple of days. Or they take some medication that it brings it right down quickly. And so it's not so much dangerous per se, but it's something that, just to be aware of. So again, not everybody with bipolar 1 will have that experience, but that's something that we're noticing. If some people have a naturally high level of serotonin in the brain, then ayahuasca can sometimes be a little challenging for them, Would
you say like a lot of people are scared? It seems like kind of a whole different beast, ayahuasca versus mushrooms.
Yeah.
Is it because there's vomiting and shitting with that? There's that sense of you're going to die with that, right?
Yeah. Yeah. That's that ego death. Yeah. The ego death is a big thing that people strive for with ayahuasca. If I look at I've created a persona that I show to the world that keeps me safe and helps me be successful in a certain way, but it's not really my authentic self, but I'm showing this to the world. I start to believe that's me. And eventually that's my identity. It's not real, right? It's just not really who I am. And then I do ayahuasca and I see, wow, I really see who I am. It's not a bad thing, but it's very different than what I've been showing the world or what I've believed is me. And then that can be painfully difficult, not necessarily physically, but it can be emotionally really challenging. And the purging, the throwing up or going to the bathroom, that's an emotional release of all of these emotions that are pent up, we've held on to our whole life. So it's actually really, really cleansing. But mushrooms is a little different, right? Because it's kind of more, you can have a similar experience on mushrooms. All that same stuff I just mentioned, you could have it on mushroom. But more so, it's about changing your perspective on the way you view your world. And so it's just a little bit of a shift. Like, wow, I need to appreciate, nature more, for example. But ayahuasca helps you really look at yourself. And that's hard for some people if they've never really done that before. It's a little intimidating.
So is everyone a candidate for ayahuasca? I know you said bipolar, you'd want to watch out, but if you are depressed, gone through trauma, if I were an addict, would I want to seek a certain plant medicine?
Yeah.
Or does ayahuasca cover every, disorder?
Well, the problem with the catch-22 with ayahuasca in particular is if people are actively using drugs and alcohol, and they want to become sober, they have to have some sober time before they do ayahuasca. And sometimes it's a month or two. It can be 14 days, depending on the substance. But usually it's a month, if not longer, of sobriety. We all know that people that struggle with addiction have a really hard time getting that sort of amount of days sober before getting a breakthrough. So it's a bit of a challenge for them with ayahuasca. Now, if they've been able to, maybe they went to a rehab, which, we all know that the statistics aren't great on rehabs, but let's say they did that or detoxed somewhere and felt good and had therapists or whatever, were busy in their community and then came and did it, it could be really helpful for them. But if they're actively using, it's dangerous to do ayahuasca. So it's not a great medicine for them, unfortunately.
Unless they want to get clean for a little bit.
Yeah. And I'm a big proponent of ayahuasca is not the only way to get personal clarity and awareness. I just think it's a really effective way. It's a very quick way. Done in the right environment with the right support and integration, it can be very beneficial. But people can get to the same state through meditation, yoga, healthy food, healthy conversation, you name it. All these millions of ways people can get self-realization, So I don't think ayahuasca is necessary for everybody. But I just think that if you've run out of sort of options and you've tried everything or you don't have the money to try everything, like therapy is expensive, right? So, and retreats are expensive. So if you just want to get right to it and prepare a little bit before you do it and, eat a certain way to have your body clean and then go through the process and get the support, like basically what we do at Rythmia, it can be very, very beneficial for people. Absolutely.
I think I heard you say on an interview or something that doing ayahuasca one or a couple of times is like 10 years of therapy.
At least.
You worked through it.
Yeah. I say 10 to 20, depending on how it's severe.
Wow.
But yeah, absolutely. For me, it was like 20 years of therapy in a night. Absolutely.
Oh my God.
Yeah. So it's intense.
That's intense.
It's intense.
Super intense.
Yeah.
But effective. It sounds very effective.
Very effective.
And what though, like this fake shamanic healing, you've probably seen it all.
Oh,
like, I know your facility is in Costa Rica, right?
Yeah.
It's Rythmia Life Advancement Center. So it's very Americanized to an extent. And in America, you see these circles and, people are just serving ayahuasca. If somebody wants to try ayahuasca, how do they find the right facilitator? And how do you know if you're not going to a fake shamanic ritual?
It's very hard to know. Very hard to know. Word of mouth is the best way to know, because if you have had a friend that's had a good experience with a certain shaman, then that's probably okay. But it's really hard to know, and that's why we wanted to do what we did at Rythmia, because we have a medical license for the Ministry of Health. We're super safe. We have nurses, doctors, therapists, but then we have shamans. And so the shamans, right, are all trained by this bloodline Ayahuasquero family who live in Colombia, and they come and they train everybody. And our staff go down there it's called the Finca. It's in the Amazon River up in Colombia, right? And so they train. There's all this sort of quality control, basically. But if somebody goes into Venice, California on a weekend and goes in somebody's garage and drinks ayahuasca, you're rolling the dice, really, because you don't know who that is, and don't get me wrong, some shamans travel around, and they leave Peru and they come to LA and they hold ceremonies and they're awesome. And those exist, and that does happen. But it's hard to know like who that is or why or where, because it's illegal here and you can't do it in the US and most parts of the world yet, so it's really sketchy, and I wouldn't recommend it, especially people are vulnerable on plant medicine. You don't want to be around a bunch of weirdos and a bunch of predators if you're on ayahuasca. It's not a safe place to be.
Right.
You know what I mean?
Yeah. Since you're a resort that, you have this, this whole structure. If somebody goes, I'm going to go to the jungle and I'm going to drink ayahuasca, are they getting the same, like you have a medical intake, you're making sure they're healthy enough, right, to ingest this medicine? And also I think sometimes you guys have people fly down there and you don't let them drink because of their heart rate, or,
Correct.
You don't feel it's going to be safe.
That's
now,
right.
when you go to the jungle, do you have that, or are you kind of rolling the dice again?
No. In the jungle, if you hand somebody $100, they will give you ayahuasca. This is basically how it goes. And so it's very sketchy. Number one reason that people get hurt on ayahuasca is that other people around them become violent and hurt them. And so we do a full medical screen. We do a full questionnaire before people even arrive in Costa Rica. We ask them all kinds of medical and health related psychological questions. So the people that are there, to the best of our ability, are very stable and safe, gone through a lot, might have had a history of suicidality, might have had a history of addiction, might be struggling with all kinds of things, but they're not dangerous people. And so we screen them. And then because of all the medical staff that's there, and our EMTs and our medical doctors, our nurses, it's super, super safe medically. And if somebody goes to the jungle, they don't get any integration. They don't get any context to what happened in their ceremony. They don't have any sort of point of reference. We have classes all day long at Rythmia, guest speakers, plant integration classes, what to expect when you go home, how to deal with what you're dealing with now in this week that you're here. There's tons of integration and involvement, right? So, and we follow up with people. Like when they leave, I talk to a select few. I call them. We're available. Like there's all kinds of communication with people. In the jungle, you don't get any of that. It's sketchy.
So what is one or a couple of the biggest, call it miracles, that you see with people coming out of doing ayahuasca?
What I was trained in my schooling is that there's these things called personality disorders, and there's 10 of them. And we've all heard probably some of them mentioned, like a sociopathic, narcissistic, borderline personality disorder, histrionic, dependent, all these different ones, right? Avoidant. And personality disorders are believed in the Western model are things that cannot change, just who you are. You're just labeled. That's it. That's your way of operating. It's who you are. And that was always a little weird to me. Like I never really understood that. How can someone have these behaviors that are so dysfunctional and not maybe, get past them somehow? It's because they're called egosyntonic, which means that the person that has these disorders or disorder views that their way they're looking at stuff is actually the only way to do it. It's the reality of the world, but it's not accurate. So that's the reason they give, why you can't change them. But what I've seen on plant medicine and ayahuasca in particular is that personality disorders get resolved, and especially borderline personality disorder. That one in particular does. Now, narcissistic personality disorder and sociopathic personality disorder, or it's called antisocial personality, those people don't usually come to Rythmia. So I haven't been able to see a lot of them.
Why?
Because if somebody is antisocial, which is basically the old term used to be sociopathic, they don't feel anything's wrong with them. And they're usually in a power position somewhere, and they might be abusive, and they're not looking to. Antisocial people get therapy when they're in jail is basically where that occurs usually. Yeah.
Yeah, that makes sense. So
yeah. So, but I've seen a lot of personality disorders get resolved or become much, much less severe. And that's been amazing as a clinician in mental health to see that. Another thing that the guests report have happened is that they have almost like these sort of health procedures occur on them, almost like medical procedures or sort of resolving autoimmune disorders, things like that. And I was like, what the heck is happening, right? But what I've learned through this process, and I've been down there about 6 years. When we first opened, I was there for 2 years before we opened because I had to write the license for the government. So I've been there forever. So when I first started hearing about this stuff, I was like, what the heck is this about? But what I've learned is that when our mind, body, and spirit are connected and we're completely united with ourselves in our oneness, we can heal ourselves and we can overcome things. Our body is an amazing healing mechanism. And so when people are on plant medicine and drinking ayahuasca, they're very much connected to themselves and their body starts to heal itself and of all kinds of things. Now, we can't obviously make medical claims being a medical facility. We can't state legally medical claims, but I'm just saying that the guests have reported to me all kinds of stuff being resolved, all kinds of health conditions have reduced or become eliminated. It's amazing. Really. It's actually crazy. I didn't believe it at first, to tell you the truth.
I mean, even if someone is just kind of like, they're not an addict, they're not suicidal, they haven't been through much trauma, but life is kind of just blasé, right? Like there's this sense of there should be more. I should be feeling, like excited about life. Are they a candidate for ayahuasca?
Absolutely, because they've lost the reason that they're here and what their purpose is, whether they're a light warrior or a light worker. They've lost that sort of focus. And like you said, they might not have these horrible things in their past, but they just kind of like have lost their way, right? So yeah, plant medicine gives them a sort of a new energy for life, definitely.
You're a parent, correct? Right?
Yeah, 4 kids. Yeah.
Oh my gosh. So as a parent, I know a lot of parents struggle with kids who are anxious or depressed, suicidal. Would you give your child ayahuasca? Like what age would you?
I would at age 18 and up, I believe is appropriate. If you ask the shamans, they give them to when they're, newborns.
Oh my God.
Which I
oh my God.
Which I would not do. Yeah, I wouldn't do that. But again, that's the jungle, that's the shaman world, right? But Rythmia takes 18 and up, and I think that's appropriate. The youngest should be 18, in my opinion. But yeah, if my daughter or son, or I got 2 daughters, 2 sons, if they were, appropriate for it and felt like it would be helpful for them, yeah, absolutely. Yeah, I'd have them take it, but they have to be 18 or over,
And what you've heard of this microdosing, right? Like people microdosing.
Yeah, there's all kinds of different stuff. Yeah.
Do you recommend that? Can you microdose ayahuasca?
Well, we have a tincture that we have, and it's less than 7 parts per million. So yeah, it's technically a microdose. So it's a homeopathic dose. So microdosing is a little different than what we have, but microdosing, people often think of like psilocybin or MDMA, right, or that kind of thing. So those are actually just small doses of the substance, where our tincture is a diluted version of ayahuasca, so that it doesn't have much detectable ayahuasca in it. It has the energy of it, which is what homeopathic medicine is. So, but I'm very much in favor of microdosing plant medicine for things because it's natural and there's not a lot of side effects, if any. And it's very helpful, especially the psilocybin lately. Also ketamine, which is synthetic, by the way, but ketamine is starting to make a breakthrough for microdosing also.
What is that? I've never heard of that.
Ketamine is a substance, a psychoactive substance that causes a dissociative state. And it's guided by a therapist and supervised by a psychiatrist. And usually you start off with a couple infusions, IV or intramuscular infusions, to sort of have they do it about 6 times within a couple weeks. And you have sort of this therapeutic experience and you kind of move past things. It's sort of like ayahuasca in a sense that you get to have clarity on your life and why you're doing things and move past it. And then if people are needing further treatment, they can get a ketamine microdose, which is usually a nasal spray. There are some tablets that they have, but those are less common. It's more about a nasal spray that people will do. And it doesn't make you trip out. It's just about staying in that sort of positive balance of neurochemistry to help your depression or your anxiety or whatever you're going through.
Basically, what I'm hearing is the biggest difference of Western medicine versus plant medicine is this: one suppresses and one heals from the core.
Yeah, correct. And all Western medicine has its roots in plant medicine, all of it. So all of the meds that we take, the whole list of meds, every single pharmaceutical pretty much, if you break it down biochemically and look at its organic structure. It is a plant, and they all stem from plants, but they've been bastardized, as I say, and created now in a lab synthetically, which makes sense for the masses to have, high levels and quantities, but it's lost its intent, and it's made it so the plants are blocked as opposed to letting them thrive and do what they're supposed to do.
If somebody has had an addiction problem in the past and now they're sober, I've heard them say, I can't drink ayahuasca because I'm an addict and I've been sober, right? What do you say to those people? Do you agree with that? Can they? Yeah.
I get that question quite a bit. And we've had everybody, like sometimes like a couple will come down and let's say the wife is gung-ho, she's ready to do ayahuasca, she doesn't have an addiction history, so she's in. And she brings her husband because he just wants to come and enjoy Costa Rica, but he has no intentions because he has, like you said, history of addiction. He's in a 12-step program. He believes it's a relapse. So I've been able to talk to a lot of those guys and women that come to Rythmia, and also that didn't come to Rythmia that I've talked on the phone or in interviews and things. And I think it just comes down to it's a personal decision for that individual. If you think about like what's the intention of a 12-step program, which is where most of this type of thinking would kind of stem from, right? Like if I'm sober, if I drink ayahuasca, that's mind altering, therefore I'm not sober. Okay, cool. So I get it. But if you think about like, what's the intention of the plant medicine? It's not to get high. It's not to avoid yourself. It's not to do the addictive behaviors you had in the past. It's actually to make you closer to yourself and connected to yourself and to have clarity on your life. And then when I explain it to people like that, sometimes they'll decide to go ahead and have the ayahuasca and they don't view it as a relapse. Or others stick to their thing and they say that they don't want to risk it because maybe they feel it might make them vulnerable to other things and they might go back to drinking or something. It doesn't, there's no data to show that that's what happens. But again, I respect people's sort of concerns. So if that's what they say, I say, cool, man, like whatever works for you,
Yeah, there's just so much stigma around it. And it's an interesting thing because you get kind of, in LA, I think a lot of people are more open, but it's like, I've talked with people and they say, oh, I'm really interested in doing that, but I'm too scared. But they're addicted to being miserable their whole life, right? And it's just like kind of, what is it? The Matrix, right? The green pill or the red pill, the blue pill, ayahuasca, or I don't know.
You know what I tell people that are scared is that I would be scared too if I drank, a liter of ayahuasca in the jungle with no support. But the way we do it is we give people about 1.5 ounces, maybe 2 ounces, which is considered a very little amount. And we give them that just to see how they do. And about 1.5 hours later, we just check in with them. If they need more, we give them a little more, and then we can give them a little more and a little more throughout the night so they can ease into it. So it's not like all of a sudden they're just getting rocked. It's like they get to learn about the medicine and how it affects their body and their psyche, and they can kind of guide it and ease into it. And then the medicine does what it does. But the way we administer it is to reduce fear and also get people familiar with it, right? So that's something that is helpful for people that are scared.
How many people then are coming to Rythmia?
We can hold around 96-ish a night, depending. And we sell out all the time. And right now we're not open because of the virus, right? The pandemic, but we're going to open up as soon as we can. And we're expecting a huge crowd.
Yeah.
Yeah.
Wow. That's awesome. And so where can people then connect with you at?
The best way to do it is just go to our webpage. There's Rythmia Life Advancement Center, or just Rythmia, RYTHMIA.com. And that gives all the information. We have scholarship applications for people that can't afford it on there. And there's the number to call, 800 number, and talk to a rep, who will handle their booking. And if they go to our Facebook page, that's a good way to look at all of I do a Facebook Live every Monday night for like 10 minutes, talk about psychological stuff, medical stuff with plant medicine. And then there's a lot of other staff on there doing it Jerry's on there, our CEO. He's on there talking about stuff and has little, articles. And so those are the two best ways, to get a hold of us.
So if somebody, they want to drink this medicine, but going to Costa Rica is a little bit a hit in the bill, then it's just kind of talking with people you trust around your area to find a ceremony.
Yeah. And then also what I would recommend even more than that is just fill out an application for our scholarships, which we give out a ton of those. We give out a ton of scholarships. So if you want to if somebody wants to get to Rythmia, they'll get to Rythmia. They'll get there.
This is so great. I love that you do it. And I love that you bring a medical background into it. So it grounds it more for people who do think it's just hippy dippy.
Yeah. Like me.
Yeah. You thought it was?
I used to. Yeah, totally.
That's great though. That sells it even more, right?
Yeah. I'm the guy that's on campus there that brings the science and the medicine to it, but respects the spiritual shamanic heritage, right? So I just help people feel comfortable there because I got all the background in the healthcare world that you could possibly have. And I endorse this process 1,000%, because I've seen we've had 8,000 plus guests come through there. So I've seen a lot of things and I've seen a lot of improvement with people. It's an incredible process, really.
Did I think I might have asked you this already, but what are the spiritual implications? You've touched on them and maybe throughout, but it's just connecting with your higher self that comes.
Yeah. Like we believe that everybody when they're born is connected to their body and their spirit or their emotional self. If people don't believe in a spiritual self, we say your emotional self. We believe that everybody is born connected. And then between the ages of 4 and 7 years old, their physical self and their spiritual or emotional self split. And then that's where we start to build this persona that we show the world just because whatever we need to, it makes us feel safe. And then over time, we're miserable and it doesn't work. And we're inauthentic with ourselves. And then you come to Rythmia or you do a process and you plug back in and you meet yourself again and you're united again. And then you let go of all this baggage and history of stuff. And then you're back to you. And we believe that's the purpose of life, is to get split apart, go through stuff, and then come back to who you are and have clarity. So that's the spiritual side. And that's what we're helping facilitate at Rythmia. Like we have these 3 intentions, right? That we tell people, like, number 1, show me who I've become. Number 2, reunite me with my soul at all costs. And number 3, heal my heart. So if people have those intentions during the week, all of their other intentions get met. Like, should I quit my job? Or should I, get a divorce? Or why do I feel so crappy? Or whatever. Like all that stuff gets handled when you have those 3 intentions sort of on the forefront.
So would you say then that a lot of people feel this dis-ease walking around because they're split from their true self?
Yeah, we believe that all dis-ease is a result of that, of being split. Autoimmune disorders, addiction, mental health issues, all kinds of stuff. We believe that's because people are not connected and they're apart.
So basically, the one thing people can get out from doing this medicine, no matter what, is connecting with themselves.
Absolutely. And a neurochemical reset.
Sounds like a win-win.
It is.
Yeah. Well, thank you so much. This has been very enlightening.
Well, thank you for having me. I like talking about this stuff. It's really cool.
I know you talk about it probably every day, right?
I do. Yeah. And I love it. I never get bored of it.
That's it for today's podcast. Thank you so much for taking the time to listen today. Please let me know what you think. Leave a comment, share, and we'll be back next week with a new episode.